My name's Hillman Terzian. Yesterday afternoon, we received the governor in our trauma bay. He was conscious on arrival and in stable condition. He had several injuries, which we promptly addressed. He had a spleen injury as a result of a horseback riding injury that he received. And we recommended what's called a prophylactic embolization to our interventional radiologist. And what they did was they performed a minimally invasive procedure where they passed a wire into the arteries near his spleen, and they put some coils there to stop the bleeding. And he did very well during that procedure and has been stable the entire time. He also had a minor kidney injury, which will resolve on its own, we're confident. He also had a minor fracture in one of his vertebrae in his back, no damage to his nervous system, and no signs of any head injury or any injury to his spinal canal. So his nervous system has been intact, and that injury should resolve itself on time as well. He also has 7 rib fractures on the left side, which is actually can be a very painful injury to have and can predispose people to not being able to move due to the pain. They can have complications from that, but I've been very pleased with his progress overnight. He has been very, very motivated to get out of bed. I was telling Dr. Evans, he's a doctor's dream in this sense because I wish more patients were as motivated as him. He's already been walking laps, which is very impressive. When you examine him and you talk to him, he's a tough guy, and that shows with the way he's recovering so far. And so I'm very pleased with that. He is in our intensive care unit right now, which is our normal practice for people who have a spleen injury to that degree, as well as people with rib fractures at his age. However, he's doing well enough and he's stable that we expect him to probably leave the intensive care unit sometime this afternoon. He will be in the hospital for at least another day, if not longer, mainly to make sure that his rib fractures are addressed. Because as I said, that they can be very painful, and over time, we have to make sure that he can breathe and function normally. But so far, he's doing that, so we're optimistic, and we think he has a very good prognosis.